Hello, good evening, everyone.
Good evening.
Hey, Celia, good evening. Hello, Vikramji, good evening. So good to see you in here. Hello, Miss Jaya. Hi, Jay. Thank you for joining today. I hope you all are doing well. Today, like this session is a different session from others. So I'll say you will notice something a bit different today compared to our usual sessions on Saturdays. We'll be starting starting our webinar in a few minutes so that like everyone can join in here, and then we'll start with the webinar. Hello, Miss Jyoti. Good evening. How are you? Good evening, Mr. Sarek. So good to hear you. So good to see you here. Hello, Praveen. While we wait, feel free to share any questions or suggestion for our next session in the chat box. Or if you have any questions related to today's webinar as well, you can drop your questions in the chat box. And at the end of the session, we'll be happy to answer all the questions. So today we are going to do something a bit unique, I would say. The webinars that we usually do on Saturdays, like either a session by a nutritionist or a wellness coach, it's different on today because like as part of our ongoing IBS Master Series, we are featuring a real patient sharing his journey and experience today. You're encouraged to drop your questions in between or any suggestions throughout the session. And at the end of it, we'll be happy to help. Hello, Ms. Pratha. Good evening. Good evening, Ms. Rashmi. How are you? So we'll be starting our today's webinar after a minute. Hello, Suvarna. Good evening. Good evening, Sangeeta ji. I hope everyone is doing great and that like overall this journey gives you good benefit overall. And I hope you all are continuing your journey with us. I'll start our session within 30 seconds and then we are good to go. Yeah, everyone has joined. All right, looks like we are ready to start. Thank you all for joining here today. We are honored to have a special guest who has courageously navigated the challenges of IBS and is here to share his experience and insights, like what were the changes or the improvement or the experience he has been through, like in this journey of Daily Bloom IBS. If I talk about IBS, like, of course, living with IBS can be a roller coaster ride, as a condition affects each individual differently. A person may face different symptoms when we talk to the other person that may face a different symptom. Today, we are fortunate to hear firsthand what it's like to manage daily life with IBS. Our guest will shed light on dealing with symptoms, the impact of IBS symptoms on his daily life, how he found ways to manage the condition, and how our team, both the nutritionist and the wellness coach, has helped them along the way. So, without any further ado, let's welcome our guest today. Good evening, Shashikumar ji. Welcome on our board.
Good evening.
So, like,
Good evening. Thank you so much.
Yeah, thank you so much for joining today. If I may start with, say, Shashikumar ji is a specialist dentist. He's practicing in Karnataka, which is often known as Educational Hub of India. He holds a BDS degree from Savitri Dental College and Hospital, which is situated in Karnataka, and also an MD. He's an MDS degree. He holds a degree in MDS in
MDS,
orthodontics.
Masters,
Masters in
orthodontics.
BDS, yeah, orthodontics from the College of Dental Sciences, Karnataka only. He has an experience of 24 years. So both, like he's experience, he's working, he's running his clinic as well as he's teaching. Because of his interest in teaching, he's associated with a institution. So both of these, like he's balancing a busy teaching schedule with treating numerous patients at his clinic. We all know how demanding such a profession can be. When we talk about the medical profession or any other profession, of course, it's very demanding. And managing IBS on the top of it must have been a unique challenge, I hope, Shashiji. So let's hear it from you. If I may start with, of course, we are thrilled to have you in here. The first, I would
Thank
start
you.
with, could you start by telling us like a little about yourself and when you first started facing gut issues, like what were the symptoms that you were facing?
Well, it all started in 2020. That whole year, I had back-to-back food and water poisoning.
Okay.
I don't know. I was it incidental or it was written in the destiny. So I have to say like this. From the mid of the 2020 to end of 2020, it was all in a sort of exposure to contaminated water, and it all happened accidentally. So
Okay.
then the symptoms started in 21. Like there was acid reflux and COVID was very peak at that time. So
Okay.
it was very difficult for me to go and consult anyone physically.
Yeah,
So
of
I
course.
knew some of my friends who were physicians, and I used to call over the phone and take their advices. But this acid reflux was more, and at that time, just with like any other, I just contacted some dietitian online.
Okay.
She suggested me few diet changes, but it didn't help much at that time.
Okay.
Uh, like this, yeah, the problem continued.
Okay.
So then I went to, after the COVID, the second wave of the COVID subsided, I went to the physician, got my examination done, got all the tests done. So they said it is an IBS symptom, so you don't have to worry much.
Okay.
Only make some lifestyle changes and then it should be okay. They gave me some antispasmodics.
Okay.
But precisely speaking, in my place, I could not get a proper diet advice at the time.
So
So
like,
with the medication, I was
yeah, yeah, please.
with the medication I was quite okay for some time, but some food was not tolerable, so it was irritating my gut. So that's how it all started, and it continued that way. So
Okay.
this is how it started.
It started. So as a medical professional yourself, like you definitely mentioned that you went to a physician and also like a dietitian as well. So like, were you able to manage the symptoms then after like consuming those medicines or the treatment the doctor given you?
So that was when the medicine was taken, the symptoms used to be seems to was under control,
Okay.
but you cannot depend on the medicines for a longer time.
Right.
So then I started realizing this is best to go for a change in go for a suggestion from the dietitian, diet plans. So this is how I started my journey with the dietitians.
Okay. So, like anything in
Mm.
specific that you were aware of at that moment, like these are the trigger foods for you, or I need to make these changes in terms of diet, or did you continue with your like normal routine that you are following in the normal food items? Like for how long was this confusion was there in your mind?
Yeah, that's a very good question you asked me. It really is a wonderful question for an IBS person.
Was
Whether it is medico or non-medico, frankly speaking, we don't know the what is the proper diet
yeah.
for a particular problems like IBS or IBD. So IBS, yes, there was a confusion what to take or what not to take. So I was suggested by the physicians to have more of curd, and then I think everything should be okay.
Okay.
But still, I tried with every time I used to take curd. I used to take ginger, the grated ginger along with the curd. So it was subsiding my acid reflux. But still, there was some feeling that something is not,
Something is
getting
not right.
corrected.
Yeah.
Right. And something is not getting corrected with this only curd and adding curd to the diet. So otherwise, rest of the diet was absolutely same thing what was I was having earlier.
Okay.
So then I started looking for the I stopped all the medications. Then I started looking for the dietitians, people who are specifically
Manage these symptoms.
advising the IBS diets.
Yeah. So, talking about IBS, of course, it affects you like socially as well. So, how did it affect your overall social life? Like, especially when you're attending conferences as a
Of
doctor,
course, yeah,
or traveling or managing patients.
yeah.
How did you manage?
Traveling.
Yeah.
Frankly speaking, almost for a year, life was crippled. You
Okay.
can say the life was crippled. I was restricted with all sorts of, my practice. I had to, a restriction was there. I could not attend the patient. So I had to ask my other friend consultants to manage my patients and all this is all very, very bad scenario it was when the disease was in the initial and the mid period till I got in touch with the dietitians. And traveling was restricted. I had to think twice, thrice, four times whether I should go or not go. Many times I used to postpone. I have postponed so many my travels and all, socializing, and even while I am working as a professor in a dental college in my place, so teaching. So there also during discussions I used to get the flare-ups. But you know what? For a certain period of time, we can, in Indian scenario, we all, have a tendency to hide our problems.
Right. Of
This
course.
is more in the subcontinent. So
Yeah.
the thing is, we should never hide from anybody, wherever, especially where we are working, because the problem is for a day or two, fine, we can hide. But the IBS is something; it's a disorder. Something that means the order is changed,
Right.
and to bring it back to normal, it takes a very long period of time with the right lifestyle change and
Yeah.
proper advice from a follow-up of a diet and principled life.
Yeah, you said it very correctly. Like when we talk about IBS in journal as well, depending on the symptoms, of course, and the profession we are in, or maybe even like let's not talk about in particular medical life, like the normal professional as well, any other profession, the person will face issue because you're not able to manage your routine that way, the way you wanted to.
Yes.
Yeah, traveling, of course, that is like one major aspect which is affected when you have major symptoms. Of course, whenever you are going out, or maybe you are sitting with your friends, or you have an event to attend, so over there are circumstances that we cannot even that is not under even our control. So of course, over there it's way
It's
too
not under our
challenging.
control. Yes.
Yeah, exactly.
Yeah. So never try to control it. It's a natural process. It's a
Yeah,
natural response that body is trying to throw out something that it is not able to keep it inside.
right.
So the more you try to control that and then keep it inside, the more the problem you are making for yourself. So
Yeah,
better you when you are diagnosed, whenever you are socializing. So that but even controlling that emotions also adds to your stress.
right. Of course.
There is social stress and also there is the stress from inside.
Inside.
So both will add to the stress and aggravate the disease. So disclose that you are having an IBS problem. So you need to relieve yourself. That's all. There is no other way to manage these things. And so people will understand. Probably some people will say, yeah, he has got IBS. Maybe it's fine. But over a period of time, you should be bold enough to say that I have this problem. I'm managing it.
Yeah, exactly. Use the
So that
word correctly, managing, because IBS is something we can manage. If you know how you can
we
manage
can
your
manage.
lifestyle overall, IBS is something which is easily manageable overall. And of course, you have
Yes.
to be like on track all like majority of time, I would say, talking about in terms of diet or any kind of lifestyle modification you're doing. That is very, very important. Of course, that is really
Yeah,
important.
that's very important.
Yeah. And like you
Mm,
mentioned, the point,
that's
like
true.
it also creates a stress. There is a stress in our brain, like, okay, this is affecting me. So the gut brain dysfunction, that is something which is very important to
Yes.
understand.
Very important.
Yeah.
Yes, yes, that's
So
true.
that
Never ever stress yourself in that period.
Right, exactly. Because that's what we focus on, and on our program, the wellness coaches helps you throughout, like how you can manage your stress
Yes, yes.
along with your symptoms. Because
Stress.
whenever you have a
Hmm.
maybe abnormality or there is some gut issue, of course that is going to affect your brain. And similarly, if you have external stress, like you mentioned, like you have to go somewhere, you have to attend something, you have to attend your patients, and still you're facing some symptoms. So that will also create more amount, there will be more frequency or the flare-ups will be more. So of course, everything is
Clear
inter.
of Sulimar. Yes, yes, yes.
Yeah,
Yes,
that is
yes, yes.
very
Everything is
correctly you mentioned.
intertwined.
Yeah. So talking
That's true.
about like how did you come across Daily Bloom and like what has been your experience like working with our nutritionist and the wellness coach journal?
Yeah, see, I have been searching over the social media and other platforms about how what are the dietitians available and how people are different from, because there are so many people who says manages, once you start searching what is IBS in Google, everything gets linked now. So many things, references you will get. So I went through all those things. Then in Daily Bloom IB, Daily Bloom, there was a mix up of both diet as well as the wellness
Right,
coach. So see, it's not only the diet, along with that the wellness coach. So that interested me here. The proper nutrition, not only the nutrition, what happens is wellness coach, there are so many exercises available on the application to relieve the bloating, to improve the gut health. There's so many, though I was doing yoga earlier, I was not knowing this specific asana will help me to relieve the gas in the
right.
gut.
Yeah,
So when I started doing these exercise target specific exercises, I really felt the difference. When we do those asanas, we can see our mouth is wet. There is more of saliva coming in the mouth. So that relieves the stress from the mind. So this
of
combination of
course.
both the nutritionist as well as the wellness coach is really a wonderful thing that Daily Boom has come up with.
Oh. No, that's really a good point that you mentioned. Of course, like Daily Bloom is planned according to this only. Like it's a holistic approach when we talk about like IBS. You have to take that approach completely. Whether it's when we talk about nutrition, of course, the nutritionist is the one who will be handling your dietary aspect. The second is the wellness coach, which is handling your physical wellness and mental wellness.
Yes, yes. Stress, more mainly the
Yeah,
stress relieving, because whenever there is a flare up, first thing is the brain gets affected. We
exactly.
become depressed. When we are depressed, again the gut gets affected.
Right. Yeah.
So because gut is the second brain, so it are interrelated. If the gut gets affected, the brain also gets affected. So we have to relieve both
Right.
relieve the stress from both the things. So wellness, keeping ourselves calm during the flare up and all is a very challenging thing. But one thing, people who are affected with this should keep in mind that let it flare up. I have a way to manage it, so I will manage it.
Yeah, that's the
So
right
you start
approach
with this
actually.
approach.
Yeah,
Yeah, yeah.
no, that's fantastic to hear
Because
about
there
this.
are so many people who are suffering with this without knowing how to manage it.
Correct. No, this is a like a very basic question when I as a nutritionist or any other nutritionist or a wellness coach is asked for. Like usually people ask that I don't know how to manage it. Like it comes up suddenly, but then you have to see like what is affecting your body, and this is how like this program is planned. We will focus on each and every aspect, whether it's talking about your stress or anxiety levels, talking about your food intake, whatever you're eating, even like the even single ingredient might affect you or may gives you a flare up. So
Yes, 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 yes,
yeah,
yes, 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 yes.
exactly. So
We don't
that's
know, as a common man or anybody other than the nutritional dietitian. So we don't know which affects us, which doesn't affect us, and how to try which affects which is good for us. The
yeah,
right amount of quantity, the time to take it. All this, it's a complete disciplined program. It needs a complete disciplined management.
no, of course,
If there is a small variation also, the whatever progress we have achieved in this will again will go back. We have
exactly.
to start from zero.
Yeah. So that's what
again.
the focus was like from the nutritionist point of view. I hope like your nutritionist has helped you throughout the program to focus on the ingredients, and when we talk about the amount of food item. So three things as a nutritionist, what I suggest to my clients are like first thing, what you are eating. The type of food item,
Yeah,
and second is the
yeah,
amount of food item, that also matters, and of
amount
course
of
the
food. Yes,
timing,
yes,
at what time you are eating, or the meal gap. These 3 points have to be keep in mind so that
yes.
we can manage symptoms. I hope like these pointers
What
were,
time we are eating and what we are eating at what time.
yeah,
What we are eating at what time. Some foods
exactly,
needs to be taken in the morning session. Some things needs to be taken in the afternoon session. Some things needs to be avoided in the night,
right.
in the dinner. So these are the things really can be is nicely given by the nutritionist.
No, no, I totally agree to this. Like these are the pointers which we have to keep in mind specifically whenever we have gut health issues. So these are the basic pointers. So like if I say like what are the changes that you noticed in your body, like since the day you joined this program, and how has this like overall focusing on nutrition helped you? Like even as a medical professional with so hectic routine, how are the symptoms or there are body changes? Like what are the body changes that you see?
Mainly, my energy levels. The my energy levels were very low when I before starting with a daily bloom. So after 10 days, I started noticing my energy levels have increased
Okay.
with this diet and the wellness coach and the exercises, the asanas are there. And there is also one thing, progressive muscle relaxation.
Yeah,
Just for 10 minutes, you just sit in a calm area, in relaxed area. You do that practice quietly. It really relieves the stress.
yeah,
Then the diet,
right.
the proper diet, I could notice my energy levels have increased.
Yeah. Yeah, of course, like whenever you have any symptom in your body, like there are changes, like some people say we are losing weight. So that also leads to your low energy level. So did you notice any change in
Mm.
your weight as well? Like when you joined this program and right now, like how is the change in your weight is there?
Yeah, I've started gaining the weight, but not to completely what I'm supposed to. But the energy levels is really tremendously have changed. That really I could make a difference in the matter of 10 to 15 days.
Oh, that.
So when my energy levels have changed, definitely when I complete this program, I would be much better.
Yeah, of course. See, like your body needs time to get that, for
Yes,
adaptation,
yes,
I
yes.
would say. So, like you mentioned, like
Adaptation. Yes,
within
yes,
10 to 12 days, you can see the changes. So this is really great because
yes, yes,
energy is something which we are dependent or our routinely work is
yes, yes, yes.
dependent.
Of course, of routinely work dependent. And yes,
Yeah,
first of all, for me, every day the routine starts from 8 to night 9:30. So in between some breaks. So
okay,
with long working, style, we need first thing is I need energy.
correct.
So I was feeling very much tired in between. So after 10, 12 days, when I started feeling that I'm regaining my energy. So I really thank Suchitra ji for a proper planning of the diet for me.
Yeah, of course. Like as a nutritionist, Suchitra has helped you throughout your journey, and talking about your energy
Mm,
level and everything is like you're gaining, like your weight has increased. And I hope like all the symptoms on
yes,
one day you'll see, like you will say, I'm free from symptoms basically. There are no flare-ups. Because as a nutritionist, we really would like to hear that answer, like, ma'am, we didn't face any flare-up this week. So this is something we all expect from our clients, and I hope you get to
expect
that
yes,
stage.
yes. Yeah,
Yeah,
yeah.
this is our
Get to that. Yes,
expectation,
yes.
and
I agree.
this is what daily bloom program is based on. Like the moment the other
Based
person
on
says, this gives you motivation as well. Like you said, after 10-15 days
yes,
you
yes.
started feeling energetic, so that gives you a
Yes,
kind of
yes,
positive vibe from the program, and that motivates
yes,
you.
yes, yes, yes.
Yeah,
That motivates.
talking,
Not only it reduces the stress. It makes us to feel good.
right, of course, like the energy level, the positive approach toward the program or the following diet,
Post.
that
Yes,
also
yes,
improves. Yeah.
diet.
Also talking about,
Mm.
say, that you mentioned like you have a hectic routine from say 8 to 9 a.m. until late night because you are teaching as well and then you handle your clinic. So how did you manage
Mm.
your diet routine? Like, are there any particular tips that you followed that was given from your nutritionist? Or as a foodie, I would say, what all things did like helped you throughout your journey? Like, were you able to manage your diet or do you think it's way too restrictive?
Uh, See, as a person with IBS problem, first thing is never feel you are restricted. You have no option left.
Yeah.
Keep that in mind. Prepare yourself that you have no option left. You are at the mercy of the syndrome, IBS problem. So you have to respect it. You have to respect yourself. Keep yourself better. You have to respect the lifestyle that time. So first thing is keep anything that is in my mind that, oh, I am missing this. I am missing this. No, right now you have to follow the strictly the diet, the timing, everything. So I really thank
Right.
my wife. I showed all this progress what my nutritionist has given. She used to prepare and put me in the box. I used to tell her, prepare and put it in the box. I
Yeah.
used to carry my box. I used to carry 1 liter of water to measure how much of liter of water I am drinking, because she was always asking how much of liter you drink every
Yeah.
day. So I make sure that I drink 2.5 liters minimum per day, not gulping it, sip by sip we have to take,
Yeah.
because during IBS absorption will be very poor. So when we just gulp the water, so nothing will get absorbed. You have to slowly, sip by sip, you have to take it. So I used to carry a liter of a bottle. Then the whatever the diet she had given, prepare. My wife used to prepare and give me in the box. I used to carry with the bag and have it at the right time. That really helped me a lot. Probably my wife would feel that I had to prepare so many, but she never felt that it is something really hectic for her.
No, no, of course. Like these are the pointers, like you mentioned about water intake, which is very important when we talk about digestion. Okay,
Mm.
so we have to keep in
Yes,
mind that
yes,
that water intake is good enough. Second, the kind of food you're eating. So you just mentioned you carry your lunchbox every day with you. So this is a very good routine because usually what people do, like
yes,
they
yes.
buy it somewhere, like they purchase something from outside or they order something from outside, and that is the most
Outside
like
also.
we can say the culprit overall, which is causing us flare up again
Yes,
and
yes.
again. So this was a really good routine that you followed. Also,
We
like
have to follow it, because though we get it things from outside, whatever your nutritionist must say, but there will be a difference between the homemade and the outside.
of course, as a nutritionist, we always say like homemade food is something which should be preferred because we exactly know what we are eating. Like the composition of food items, we exactly know what the person who has cooked for us or ourselves, we are cooking for ourselves. It's because that is what important is. The amount of food or the kind of
Mm.
ingredient that you are using in it, that matters a lot. So this was a
In it.
really good point
That
and
matters a lot.
that you managed overall. And we can see that you have gained so much of symptom relief from it. We can see that.
Definitely, definitely. Yeah, yeah.
Right. So, like at the end, like what is the advice from you would like to give to our audience today? Any quick tips for managing IBS that have worked for you?
Uh, Actually, there are so many tips on the application itself. When there is a flare up, there is home remedies. They say use of chamomile tea, use of ginger tea, all those things. So what I used to do is I used to carry the ginger with me always, many times.
Okay.
I've kept wherever I stay for a longer time. I've kept in the refrigerator the ginger and a small knife. So just clean the ginger whenever there is flare up. Clean the ginger properly, remove that skin. Then you can chew. First, it's little hard to chew on, but once the for a moment, but once you chew and then ingest the juice, you will feel that the symptom is relieved and your depression is suddenly taken off. So I would say ginger is the best thing to have to relieve some amount of flare up whenever there's a flare up when you're not at home.
No, of course, like ginger is very helpful, and there are decoction drinks in the morning that you can prefer, like
Yes,
chia seed water or lemon ginger water, coriander water is there, or
yes,
fennel
yes,
seed water. So various decoction drinks can be included so that you get relief. So this was a really
yes.
anything other than this, like when we talk about anything, talking about stress management that you would like to give tip on. How did you manage your stress?
Of course. Yes, yes. The stress is a part of this problem because that's why it is called as an irritable bowel syndrome because it's a mixture of so many things. The stress. Uh, so breathing, and then there are so many exercises they are given, and then breathing helps a lot. And so
Yeah.
now you in the initial period where the new patient does not know how it is happening, what is happening because it is he feels the gut it's an issue related to the gut, but why my brain is depressed, how to come out of it. So it's a relation between both the gut and the brain. Both needs to be taken care. So whenever there is a situation where there is a stress, first thing is by doing the meditation, by doing pranayamas, and in the application it have given progressive muscle relaxation. Just sit in the quiet place for 5-10 minutes. Practice that, the stress will relief.
Yeah, of course, I can see like your the nutritionists have guided you a lot about food, and of course, your wellness coach has helped you a lot because you know the tips and the
Yes, yes,
tricks
yes.
how you can manage. So, really good to see that.
Yeah.
Yeah.
Hmm.
So, thank you
Actually,
so much.
I told you, I was doing yoga. Yeah, yeah, I was doing yoga practice since very long time. But there
Okay.
are so many, asanas that targets only specifically get to relieve the gas in the digestive system. That really, those are things really good for us.
Yeah, of course, like yoga is something which is very beneficial when we talk about gut health or specifically when we talk about IBS. So, like the videos or the resources which are available on the app or the guidance from the wellness
Uh,
coach is very important in that aspect. And really good to hear that everything from your nutritionist and wellness coach helped you throughout the program. So, thank you so much for sharing your journey with us, Shashi Kumarji. It was like
Thank you.
truly
Mm.
inspiring to hear how you have navigated through your IBS challenges or the symptoms while managing such a demanding career, I can see. So, we are sure our audience
Yeah,
has
yeah, yeah.
gained
Mm.
valuable insights from your experience today. So, thank you
Hope
so
so.
much. Now, we are opening the floor to questions. Feel free to drop your queries or any kind of comments or any questions that you have. I'll be really happy to answer to them. And also, Shashi Kumarji will be answering few of your doubts if you have in case.